Welcome back. Now, this time, it's Focus Africa. Today, we turn our focus to Kenya, where a Kenyan court ordered striking doctors and also the governments to reach an agreement to end a nationwide strike that is now in its 5th week.
Now, doctors at public hospitals downed their tools in mid-March over pay and working conditions, disrupting services for thousands of patients. At the center of the row is a move by the government to slash the salaries of medical interns who make up about 30% of doctors.
Now, Labour Court Judge Bairam Ongaya said the National Doctors Union and the government must immediately convene a meeting without conditions and conclude a written return to work formula not later than close of work yesterday, Friday.
And now we're being joined from Kenya by Dr. Davji Bhimji Atellah, and he joins us live via video chat. A very, I want to say good morning, but do not know the time. So help me. What time is it over there? Although it's bright behind you.
It's 12 noon, so I think
it's noon.
Good afternoon.
It's noon.
Good afternoon to you
Good
over
afternoon
there.
to you. Let's start, right? Walk us through the current situation with the doctors' strike so far. It's now counting into its what, 4th week?
5th, I think.
5th week?
We are on day 38.
Right. So walk us through the situation. What's happening currently in Kenya regarding the strike?
As we speak today, we still have all the doctors currently on strike. They are from 27th of March to Thursday. We were not having any negotiation because government was insisting that we have to suspend the strike before we get into negotiation. But when the judge gave a directive that we can now negotiate and have a return to work formula within 48 hours, we now negotiated yesterday, on Thursday, and the whole of yesterday, and also the whole of yesterday night. We have progressed on some of the issues, but we are still having a deadlock on the issue of medical intern doctors, whose salaries were reduced by 90%. And this was violating the collective bargaining agreement. They had said because some of the doctors had gone to court and got an order that was suspending that particular reduction, the government was saying we should then let the court process be finalized before we discuss that matter. But that was one of the main reasons why we were on strike, and we know very well that legal processes may take up to a year or 2 years. So it is impossible for the doctors to go back to work saying that the reduction of pay of the intern doctors then be a subject of the court. And therefore, it will show a violation of the CBA, and it means no doctor will be safe, and even the employment of other doctors will not be guaranteed or protected. So that's where we are on the negotiation, and I think we'll have more meetings this afternoon because we had to have some in the morning where they were a bit. Government was aggressive to have a clause on this, but I mean we cannot just return to work with promises without knowing very well that the issues that took us out of work are not implemented. But I think now, since they gave the orders, we are at least talking. Before that, there was no any talks.
All right, so Dr. Davji, now you mentioned that some conditions have been met, and the major one is about the doctors' pay. If I'm correct, the doctors had their pay, I think, slashed, and they have been having this issue for the past 7 years where they've been receiving the same amount. And also there's the instance or the issue of the interns as well regarding how much they are going to be paid as well. Exactly how much, by how much were the doctors' money slashed by, and how much exactly are the interns supposed to be paid? What are the doctors advocating for at this point?
The doctor interns from our collective bargaining agreement of 2016-2017 should be earning 206,000 Kenyan shillings, which is about $1,800. But then the government reduced it unilaterally without complying to collective bargaining agreement 7 years later, that is this year, by 90%, that they from about $1,800 to about $300. And therefore that was a big concern to us because it meant that any other doctor's salary that we negotiated is not safe. We also have the basic salary that we negotiated from 2017 has not been implemented for 7 years. So that's what I could see from our engagement yesterday. Government was ready to implement, but then we are not confident that if they promise to implement that, and on this other side, they don't want to discuss the reduction of salaries, whether that is goodwill, because that may just be a trick to really return doctors to work while there is a violation. And again, we know that we are advocating to have more doctors employed. We want to have hospitals are operationalized, where we have drugs that patient come in, they can actually get, whether there are reagents in the labs, so that there is an holistic approach to management of patients, something which has been lacking. Because you go to the hospital, but then you're not supported. You get a patient that has an emergency, but you don't have emergency drugs. So you end up losing a patient that otherwise you would have protected. Those are the reasons why doctors are out, so that we can make the public healthcare functional, in essence.
Right. Now, President William Ruto has said, he's made a couple of comments about the doctors. He first says that, quote and unquote, quote, you were being unreasonable, unquote, where he told doctors and he asked them to return to work, and he also agreed to offer them what the government has made. He also was quoted saying, and I quote, the country must live according to our means, end quote. Is there no middle ground to the request of the president from the side of the doctors? Can a line be drawn and say, okay, look, let's come to the table and find a middle ground?
I think this is more of an issue of priority, because the wage bill currently in the country could not, 47% of it cannot be subjected to the doctors only. It's a matter of the political leaders that are there in the country. In fact, they contribute about 70%, the political leaders. So it is not right that you are considered as essential service providers, and then when there is a complaint or a concern on wage bill, or they say wage bill is ballooning, then the first act is sent to the doctors. I mean, that is what we are saying is not right. I mean, if we are essential service providers, then that also need proper budgeting for the doctors. We are not even discussing salary increments. We are talking about salary reduction, and yet we pour a very small percentage of it. Our salaries and entertainment allowance for political leaders or for politicians. So for them to say that out of the wage ballooning that makes us to have salary reduction, we didn't find that to be right. So that's the reason why they have not paid the best plan that we agreed 7 years. We didn't find that is right. And that's why we are saying, if the wage bill is ballooning, we as healthcare workers, as doctors, we should be inside it. And if the balloon is bursting, we burst together.
Now, regarding the issue of reasonability, lives are being lost, aren't there? I mean, and these doctors are out there protesting while lives are, people are dying. Now, the question is, who exactly is being unreasonable? The government has said, this is what we have. And the doctors are insisting that we are not going to take that, we want more. Although you said that there have been some conclusions since yesterday. But regarding the lives that are being lost every single day, people traveling from long distances only to come to hospitals where they still lose their lives, reasonability, big question. Who is unreasonable?
There's a real concern for us. That's why we don't go on strike for fun. The last time we went on strike was 7 years ago. And we were proceeding on strike because the commitments that we had had with government over the years are not being implemented. Instead, they're being violated, meaning we are not as essential as you may think. And also, before we proceeded on these strikes, we gave notice. Ideally, doctors take an oath, an Hippocratic oath, not to do any harm. But you don't do harm if you're at home, not in the hospitals, because we don't build the hospitals. The hospitals are built by governments. And also, as a doctor, despite of having an oath, having the stethoscope, having the paraphernalia for services to offer, you cannot go to a petrol station and use your stethoscope or your title of being a doctor to fuel your car. Or that you can't show your landlord that you are a doctor or you have an oath. Then they pay your rent. And I mean, that's the reality. So we must come to a point that we see that doctors are also workers that need to be compensated and that need to be prioritized. Because then if that is not done, then they have no ability to actually go to that hospital to get care, to offer care. We have conditions where doctors in Kenya do not have medical insurance. And when they become patients, we have to now do collections and ensure that they get care. We had a case of a doctor who had a cancer. We had to contribute for 7 months. By the time we had enough money, she passed on. So we have to come to a point and realize that, yes, these are doctors, but they don't have any miraculous existence that do not need them to pay bills, or they're not robotic to offer the services. That is the notion that is being used to blackmail reality and make government abdicate its responsibility.
Right. I mean, it's going into its 5th week, right? It looks like there's no end in sight. Where do you see this matter going? Is there an end somewhere? Who will cave in, and at what cost at this point?
Yeah, we have had discussions now with government, and we've told them outrightly that We do not condone reduction of salaries and wages, and if they correct that, then I think even tomorrow doctors will be going to work. But if they don't, then there's no possibility of somebody going to work. And the other issue that we had also expressed very clearly is that after the 27th of March, we had a negotiation with the government, and the government walked out of the table. So it's government who stayed out for over 2 weeks without engaging the union completely, just giving threats, victimizations, and conditions. And in that period, it is the government that was continuing the strike, because we keep saying government has been on strike for the last 7 years because they have not implemented the CBA. And therefore, doctors going on strike for these days was just to join the government, to remind them that they need to actually implement what was signed and what was agreed upon.
Well, Dr. Davji, Bhimji, Atellah, thank you very much for joining us. It was a pleasure to have you explain the instance that's happening inside of Kenya.
Oh, yes, indeed. Many thanks to you. And we'll keep our eyes on the story as it continues to unfold. And we hope that the strike comes to an end.
Thank you.